This is the Psychcast by MDedge, where we bring you interviews with leaders in the fields of psychiatry and psychology and masterclass lectures. I'm the voice of MDedge Podcast's Nick Andrews. In episode 138 of the Psychcast, Dr. Lorenzo Norris welcomes his colleagues and his friends from the Group for the Advancement of Psychiatry, or GAP. Now, normally, in a typical year, Dr. Norris and I would go to White Plains, New York, and we would conduct multiple interviews with the various members and participants at the GAP meeting. It's where we've gotten some of our very best episodes. But because of circumstances that most of us are well aware of with COVID-19, that meeting is not being held this year the way that it normally would be held. However, it has also posed new challenges that need to be addressed in the mental health community. We've taken a lot of effort here at the Psychcast to address those concerns, but there is one that required more than just a one-on-one or a one-on-two interview, and that is the case for this episode. In this edition of the Psychcast, Dr. Norris welcomes his colleagues from GAP to discuss school reopenings. They touch on topics about how children will get mental health care at school and what to do for children who can't physically go back to school and the stressors of being at home. They also address what to do for new adults or young adults who are being dropped off at college or who are attending college virtually. It's a pretty big episode. There's a lot going on with school reopenings, and it's something that's going to be addressed, I suspect, for the coming months, if not longer. Okay, so without any further ado, please welcome the editor-in-chief of MDedge Psychiatry and the host of this show, Dr. Lorenzo Norris.
This is Dr. Lorenzo Norris, editor-in-chief of MDedge Psychiatry. Today, I'm pleased to bring you the GAP Media Committee, and we're actually going to be talking about a topic that is very relevant to a number of, well, the whole country really, and it has to deal with school reopening. So we're going to really dive into maybe some of the issues that your patients may be facing, that you yourself as a healthcare provider may be facing. And so we have a really great group of panelists here to talk. So stick with us here on this Psychcast because it's on everybody's mind and I think everybody's going to enjoy it. So Dr. Jack Drescher is going to be moderating this podcast, and Dr. Drescher is the chair of the GAP Media Committee. Dr. Drescher, welcome to the podcast.
Hi, Lorenzo. Thank you. I just want to thank all our listeners out there. This is the Media Committee of the Group for Advancement of Psychiatry, and I'm honored to be with this group. My co-chair is Carol Bernstein. Carol?
Hi, everyone. I'm Carol Bernstein. In addition to co-chairing the GAP Media Committee with Jack, I am a professor of psychiatry at the Albert Einstein College of Medicine and the Montefiore Health System, and I think this is a great topic for us today.
And Jeffrey Friedman.
I'm Jeffrey Friedman. I'm an associate professor of clinical psychiatry at Weill Cornell Medicine, and I also chair the Public Affairs Committee at the New York State Psychiatric Association and co-chair of the one at the New York County Psychiatric Society.
Gail Salt.
Hi, I'm Gail Saltz. I am a clinical associate professor of psychiatry also at Weill Cornell Medical Center and the New York Presbyterian Hospital. And I'm a psychoanalyst with the New York Psychoanalytic Institute.
And Peter Kramer.
Hi, Peter Kramer. I'm an emeritus clinical professor at Brown University in Providence and the author of 7 books, the best known as Listening to Prozac from 25 plus years ago.
Right, and I'm, in addition to being co-chair of the committee, I'm a clinical professor of psychiatry at Columbia University, an adjunct professor at New York University, and a training and supervising psychoanalyst at the William Alanson White Institute. So we're going to start talking today a little bit about kids of all ages and going back to school and the implications, not just for the kids, but also for the parents. And we thought we'd start with some personal accounts, and we actually have some people on our committee who have kids. So Lorenzo, I'm going to throw it back to you because you have the youngest children in this group.
Yeah, Jack. I got to tell you, listeners to the Psychcast know I have 2 kids, Taylor, my 14-year-old, and Sydney, my 11-year-old. And it's really, 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 really chaos. That's the best way to describe it. Because throughout the summer, there was going back and forth as to whether we would be online or to whether it would be a hybrid. And many people might be in the same position that I was in and that my children were actually not only did we have all these questions about what was the nature of the school going to be, they were transitioning into new, if you will, systems. Taylor's going to high school and Sydney's going to middle school. So on top of this uncertainty in regards to whether it's going to be online or whether it's going to be hybrid, and then, just the typical questions that you would say that kids would ask, like, are my friends going to be in school? Is it going to be all day? Do I need to wear a mask? And then, parents have to answer these questions. And, a lot of times we don't have any more information than the kids do because it's changing constantly. So to say the least, it has been challenging and stressful, just to put it mildly, Jack.
One of the things that I wondered about is, like, are parents like yourselves communicating with other parents about what to do and how to manage these experiences that are going on right now? I mean, what's the parental networks like these days?
Well, you know what? That's pretty interesting. I definitely think that parents are communicating. I definitely think that they are communicating. But with that being said, I think it depends on, I definitely think that parents are communicating, but I can only speak from my vantage point. All right. Sometimes I could be in my own bubble. So yes, parents are communicating, but on my street, as an example, we have a whole bunch of educators and principals and things of that nature. So parents are communicating. There's been this talk of, like, if you will, pandemic pods, and what are you going to do and how are you going to do it? And what's this going to look like? So parents are communicating, but in my honest opinion, sometimes that communication just tends to ramp up the anxiety, because whether there is, and I'll give you a couple things that I've noticed. When you start communicating, you start figuring out which kids are in which schools. So whether you're in a public school, a private school, and whether or not that school is going fully in person or online, when you're communicating, what I've found out is that people, even on the same street, have very different experiences. So it ultimately still falls back to you. But yeah, parents are definitely communicating, but a lot of times they're not, I don't know how the quality of that communication in terms of solutions, as opposed to just kind of ratcheting up the level of anxiety because of the constant movement.
Gail Saltz.
I'm hearing from a lot of parents who are extremely anxious about how to make this all work in their home. They're working, and having children home when that was never expected to be the case is making it extremely difficult. And I would say, sadly, I realize it's 2020, but much more difficult for women who are bearing the brunt of being responsible, or at least feeling responsible, even if they have, even if their partner is at home and is doing things, somehow the feeling that they are responsible for the education of their children, the happiness of their children, helping their children with their anxiety, keeping the home in order and working, such that I'm hearing women basically feeling responsible for, and data is bearing this out, about 70 hours a week of work, mm-hmm. compared to men's 50 hours a week of work. And that strain adds to the anxiety that they already have, because there's tremendous uncertainty as to when this will change or, resolve in any sort of way. So I am just hearing from a lot of women, patients, who are really struggling with not only the anxiety of how this is all going to be, but how they're supposed to manage all of this in an ongoing way, and not make things more difficult for their children in the process.
Carol Bernstein.
Thanks, Jack. And I want to piggyback on what Gail was saying, because I've been hearing this even just in the medical profession, that what's going on, it's not just affecting the family, the children, the people, but also the workplace, because whatever the pressures are and women, I've heard the same thing about women. A group of pediatricians actually at Montefiore got together to talk together about their challenges, and they were really, really upset, turning to the institution to be aware of this, so that this is all a spillover effect. And I know, as we're going to talk about a little later, this is something that's affecting the whole society in every aspect of what we do. So it's not just an individual, what do I do with my child, but how this manifests itself and the ramifications of it for everything that we do. So for instance, in an academic setting, people are saying, I don't want to be held to the same productivity standards, as an example, in this particular period of time, because I have so much else, the 70 hours that Gail referred to, going on at home, and I have to manage my children and deal with my own anxiety. I mean, and I would say too, I think this was to Lorenzo's point, talking about it to some extent ramps it up. And we have to learn as adults, not just as parents, how to contain our own anxiety at the same time that we're trying to minister to our kids and help them with theirs.
Jeff Friedman.
Yes. To expand on what Gail and Carol were talking about, I do mainly telepsychiatry now. So I see a number of women who are mothers and the anxieties about working at home while the kids, I guess this is hard, not just for our patients, but for the children, because I see how they're acting out. And that's a whole other issue, how they're being affected by this pandemic. But there's an additional thing that I deal with because I work in a cancer hospital, and the women that I see are, they're doing very well. And the ones I'm thinking about right now doing very well because, they're working full-time at home. But an extra concern, if the kids go to school, and there's there've been uncertainties about that. It's not clear if they're going, if they're not, and that's affecting clearly how, well, if they end up going to school, then they'll be coming home and they're at increased risk, for getting sick. So that's just an extra thing that I see from working in with women who have additional risk factors for getting COVID.
So, we've heard how this is, the question of sending kids back to school is a gender issue. It's a professional career issue. It's also very much cross-generational. I'm a grandparent. Two of our grandchildren are headed for school. The school was pushed back a week. So on an emergency basis, my wife and I were recruited to become the childcare for the grandkids while the parents go to work. Well, that creates risk. Our daughter is a doctor. She does clinical work. She's exposed, theoretically, possibly to COVID. So she had an instant test before bringing the grandkids to us. And that, works for now for the first week while school is pushed back. But what happens when the kids go to school? Then they're potentially exposed. Can the grandparents come in again? And these questions, which, sound local in particular, are really general across the culture in this sense that they're unanswerable. It's not just that there isn't a best answer, there isn't a good answer. All the answers involve risk, either for the kids who are not getting the care they should get, for the people involved who are getting different levels of exposure. That is the kind of question we're facing. And that's why it becomes a psychiatric or psychological question that in our practices, we would see people who are facing problems that just have no really good answer.
Lorenzo.
This is just listening to everybody talk. Actually, I find this actually quite helpful. But I wanted a couple of points that were raised that I thought were really, really important, particularly when it gets into the roles in men, women raising children. And I just, again, using my own experience, I kind of think that coronavirus in many ways, it not only does it affect, but it reveals what already existed. So that gender equity, as Gail was talking about, it is absolutely, it is there because, for instance, this morning, my wife was going over the schedule of Taylor and things of that nature. And it was like organized. It was just like, one of my meetings or things of that nature. And I found myself asking, well, have I been putting myself a little bit on blast here? Have I really been attending to this the way that I need to do this? What has been the balance? I would like to think that I've been aware of this and I've done work, but as Gail pointed out with that 70 hours, it's there because I told my wife, like, you know what, I'm going to be talking about school reopening this morning. She's like, what? Oh, great. And she talked to me literally for about like an hour about all of the things, the group chats. I was like, whoa, okay. And to Peter's point, we also have my mother-in-law coming to stay with us. And I'm glad that she got here safely from Trinidad and things of that nature. But you were so right. It involves risk. Everything, there are no good answers. And as the group was talking, the question that got to my mind was that not only is there the labor issue, it's, are you being a co-partner in the emotional support of managing that risk? And that's a big deal as I reflect on it now, hearing you all talk. Are you really being a part of managing this risk? Because there just really aren't a lot of good answers. So just as you guys were talking about, that's what I thought about.
I wanted to just throw in the idea that as I was listening to everybody speak, the idea that we think of school as a place to send kids to be safe. And now nothing feels safe. I mean, this is, so in psychiatry, we talk about anxiety, but, in everyday English, we say fear. Everybody is afraid. And we're all afraid because we don't fully understand all the risks. And everybody is doing their own calculations about how much risk to take, which is inevitable. And I think, particularly if you're living in a couple, you always have to be careful about respecting the anxiety of the least risk-taking person. That is, in the couple, you have to make sure that whoever's the most frightened is accommodated, because otherwise, you disrupt the entire pod. Jeff.
Yeah, when you mentioned about the uncertainties, just want to also mention that I've been finding with many of my patients that they're not trusting the information they're receiving because of some of the flip-flopping of the opening of schools. It was in a couple of counties delayed and conflicting information, which, there are uncertainties. We don't know everything, but that distrust is, I think, adding to, anxiety and anger. That's something I'm sensing.
I do want to add, though, that I'm sure all of us are aware from our practice that school isn't always the most relaxing place to be, and that there are a group of children who, what are my concerns about not going to school? Potential for cognitive losses in terms of translating via Zoom, potential for not getting a mental health diagnosis that should be being made, that is often picked up in school for the first time by an educator or by a peer, and in fact, mental health care that occurs in school, that many kids get their care through the school psychologist. So those are concerns for a psychiatrist about not being in school. But I will say that I am aware that there are children who are so stressed by school, from bullying, from peer pressure, from the need for a certain kind of competitive academic performance, that are actually going to be less stressed not going to school. I'm just saying it's not all one or the other. And so I think when we're talking to patients, we have to be aware, what kind of child are we talking about? How does that child really feel? And therefore, how can we help the parent in terms of what they're planning and how anxious they feel about it and how reality-based that is?
Kara, but before, I just wanted to say one thing that occurred to me earlier, which is that I was thinking about all the kids who need to go to school to get lunch, that there's a large number of children out there who don't get fed unless they go to school. And so the implications of not going to school is a little scary. Carol, go ahead.
Yeah, I wanted to mention both about the risk factor and some of the issues that you're both bringing up, which is everybody has different tolerance levels in this time of a pandemic. And one of the things that's really important to do is to respect the fact that people have differences, that it's different for one kid than another, which is, we're all looking for a simple solution. I don't think, because of how much we don't know, it's not simple. And it's the same thing about risk tolerance, and that what might be okay for me might not be okay for Jeff or Gail or the rest of you. But that we have to value that. And just a little bit on the communication side, which is what we're talking about, because of all of the conflicting information that people don't know what to believe, minimizing your access to certain types of media is really important. And that's going to be important for your children too, because they're going to hear it. So you want to protect them, just as we did around September 11th, said, stop showing all those pictures all over again. So you need to modulate that and respect the differences.
And Jeff, I want to reinforce that, find responsible sources and reliable sources of information. There's so much fake news running around that one really needs to go to good sources, like I would say Johns Hopkins, the Centers for Disease Control. Ideally, those would be ideal sources, but nowadays. But Jeff, go ahead.
Yeah, I was just thinking when Gail was talking about how some children are only too happy not to go to school because of the bullying. I have found that with not just school, but with so many aspects of this pandemic, that everyone's reaction is different. Every person's is different. It depends on their psychological makeup, their finances, their home situation, that there's been absolutely no consistency in so many areas of how people are dealing with this pandemic.
So I wanted to emphasize and extend something that Lorenzo said, which has to do with the way that this crisis sheds light on how class issues really affect the way people do in the culture. So some school districts are going to be able to handle this crisis well, and some are going to be able to handle it poorly. We have a seasonal home on Martha's Vineyard, which is most of Dukes County. Most years the poorest county in Massachusetts, but because it's a vacation place, it has a good tax base. And it looks like it's going to be able to do testing every week for all the kids and all the staff in school. Well, that should be happening everywhere in the country. It's not terribly, terribly expensive. It's less expensive than having parents have to stay home rather than go to work. So that there are communal and societal ways to address COVID, which we are failing at. And what worries me is that people in communities with fewer resources or less good organization of resources not only face this stress of how are they going to care for their kids properly, but also they feel guilty about it. And, as psychiatrists, we don't want that double jeopardy. If society gives you a problem that's unsolvable, we don't want you in addition to be psychologically burdened by that difficulty.
So the other issue that's come up is, what happens with the older kids who are going back to college or not going back to college? Gail, you have a child in that situation.
Yes, we just brought my youngest daughter back to college. It's one of the colleges that is smaller and in a rural location, and really making, in fact, frankly, they pulled out all the stops to try to make a go of this by setting kids up to have 2 tests spaced out by 3 days each, to be in quarantine during that entire time. So they will be completely isolated. They will then, after that, have testing twice a week, social distancing, masks. Most classes will still be remote in order to spread kids out. They have canceled numerous things. There will be no dining in any dining halls. There will be no parties or social functions. So it sounds pretty draconian, but it is the way that they think they can make it work to actually keep students COVID-free and on campus. And I am really struck by how much young adults want to go back to school, even under these circumstances. Most students wanted to return. How important this developmental step is for young adults. And yet at the same time, well aware as a psychiatrist, how most actually mental health issues present for the first time in these years, in these 18 to 21-year-olds. Depression, anxiety, the schizophreniform disorders often present for the first time. Bipolar disorder often presents for the first time. And that I am also aware that mental health issues have been rising in this college age population. The services available for them on campus have never been enough, are still not enough. And now, in addition to that, they're going to be back on campus being told that they cannot in any way behave as a normal 18 to 21-year-old can behave. They can't have any intimate contact with anyone. We all know that that is quite difficult and not typical for a kid this age. They cannot be with their peers physically close in any sort of way, and they have to operate under these very, very stressful circumstances away from home. And so I think, I have a lot of concerns about what it will be for this age group. And yet it is also an age where there's a lot of resilience, flexibility, and ability to perhaps adapt to and therefore build resilience in this age.
Yeah, I'm going to take this a little bit further since I'm one with a child that's a little bit older. And I think it was the Pew Foundation that just came out with a report saying that 52% of young adults between the ages of like 18 and 25 or 30 are now living at home with their parents. So you're talking about the need for people to expand and develop and grow. And this is a generational focus. We've talked a lot prior to COVID about failure to launch, but now you have families where the kids have been away at college and now they're coming home and they're back there just at a point where they need to be going out into the world and fending for themselves. And as much as I am dismayed that my 23-year-old daughter is in Chicago and I have not seen her since February, it is true that I watch her and I think she is developing and growing in a way that the children of my friends who are home can't. So this really is a multi-generational challenge for all of us.
Lorenzo.
Yeah, I just wanted to follow up on what Gail as well as Carol said, and just bringing a bit of also attention to the mental health services that are offered on college campuses, because in my role at GW, I echo completely what Gail said. Our college mental health services are overrun. I mean, many places at the universities that you go to, you're dealing with like small cities in terms of the population when you consider the undergrad, the graduate students, and the students are definitely at a developmental point to where in terms of mental health issues, whether it's anxiety disorders, depression, substance use disorders, where the counseling services and our mental health services were already at a stretch, at a very tenuous point. And so I do become concerned about what services that we can offer. And I certainly do hope that, if you will, our students can be resilient, that they do show flexibility, that they are adaptable. But with that being said, I can't speak for you all. That's a tough lift. 18 to 20, and you can't, I listened to what you described, Gail. I'm not sure that I don't know that if you put me in that situation right now, I don't know how great I would fare at it, and I'm 47. So, that's tough. And then what Carol said, I thought that was a really interesting point in regards to those young adults, if you will, in terms of still being at home and what does that mean? I can't speak for everybody else, but at a certain point in time in medical school, I was staying with my mom. So it wasn't, in this day and age, a lot of folks aren't really completely out of the house, particularly if you're in grad school, until maybe you're in your late 20s or 30s. So that's something that I certainly haven't thought about that much, but I'm glad Carol brought that up, because I was like, whoa, that's a very good point. I think that a lot of people will need to think about that.
So I did college-age mental health care for many years in Providence, which is a rich university city. So we had Brown and Rhode Island School of Design, Johnson and Wales, aspects of the community and city colleges and state university. And I relied on those institutions as co-therapists. College is it has its problems, a good, safe place to be. And I thought, when I'm taking care of those kids, they have peer support, they got professors to speak to, they have the mental health services, however good or bad they are, the local health services. And that really is going to be missing for this year and maybe for this generation of kids. It is, we think of college as a place to learn, a place to grow, but it also is a buffer against some of the issues that our mentally ill populations are going to face.
Yeah, I've been reading in the past few days about a number of colleges that had to close and dismiss the students because of marked outbreaks. And I'm thinking of an article that our fellow committee member, Jessie Gold, who couldn't be with us today, I think it was a couple of months ago, where she co-wrote an article expressing concern that the college students the students are going to be blamed for this. And I think we have to be careful about that, because it's important that the institutions work very hard to make it a safe environment. I mean, from working in a hospital in New York City, I can see how careful we've been, and to make it a safe environment where we are in close quarters, you know, treating people who are ill. And I think the colleges have to step up and make sure that if they are going to stay open, that it's the way we're doing in hospitals in New York, keeping it a safe environment.
Yeah.
Well, I do think, you know, you're asking young adults to do something so unnatural, as you mentioned, Lorenzo. Like, it would be unnatural for anybody of any age, but particularly that is the college expectation. Those are the drives of that age group, and specifically, college is yes, an institution of higher learning, but in a social milieu where you're supposed to be accomplishing certain social, emotional milestones, and we're basically saying you will not have any of that, and we don't have a replacement. And in terms of mental health access being limited, I do think many schools, at least I'm very aware that my daughter's college, but I think other schools are trying to say, hey, there are apps we can use, there is telemedicine we can use, there are, you know, Talkspace will make available to you. In other words, they're trying to come up with other tools, which I laud them for, because I think those are necessary. But to what Jeff is saying, the idea that we would then punish students when it doesn't work out. In other words, and we see, are we punishing the state of Florida? It didn't work out there. It didn't work out in California. I mean, it's a virus that's highly contagious, and anybody can pass it to anybody. And I think that it is very concerning when you set it up as some sort of a, you know, blaming situation, or make them feel personally responsible when the system fails, essentially. And I am seeing kids being sent home for, you know, oops, I was standing next to somebody, not a party, but just, you know, any sort of quote infraction. And I think I'm concerned from a mental health perspective that basically telling, you know, young adults, older children, they failed and they are responsible for disease and potentially death is not a good thing, from a mental health perspective. And so I think, unfortunately, what's happening across society, right, is everybody wants to feel there is somebody to blame, so that there could be somebody responsible, so that there could be somebody who could turn this off. And psychologically, that's very understandable. But if we're not aware of that tendency in all of us to want to have somebody to blame, we're seeing this politically, we're seeing this, you know, in terms of society, and it's so amped up now because there isn't an answer right now to COVID-19, that we risk guilting, shaming, driving people underground in terms of behaviors because we have shamed them. And that is not helpful all around. Unfortunately, there's no one to blame for much of this. It simply is, and that's hard for people to accept. And I think that as psychiatrists, we play a role in trying to make what is maybe not so consciously being done more conscious, in trying to curb that is not helpful for anyone.
It's one of the hardest things for human beings to accept, the anxiety of uncertainty or the anxiety of helplessness. That, you know, the role of the scapegoat is to create a reason why something happened when there may not even be a reason for something to happen. And I was thinking about, you know, teachers against parents around the return to school issue. as if one group or the other could solve the problem on their own, when obviously there needs to be greater collaboration between teachers and parents to solve this very difficult problem. Carol.
Yeah, I do. Well, I appreciate what Gail was saying. I do think blame maybe is not the right word, but leadership is very important in a time like this. And when there are challenges to national leadership, whatever you believe, that then creates a trickle-down issue for the rest of society, so that people need to work together locally, because there isn't the kind of consistent, appropriate leadership that comes in greater ways. So I don't want to lose that as a point, because this is bigger than everybody, and it requires the fact that everyone has to work together, and that there are systemic and national and international factors that play into this that are contributory. And I don't mean this in a, it's not useful to just blame people, but to understand that contextually so that you can figure out what to do individually.
Well, I think that's a good point. I mean, leadership may not be able to solve the problem, but leadership can communicate a way to reduce people's anxieties while a problem is being solved. And that is a very important point. Jeff, I think you want to have the last word on this one?
Well, not everyone may like this last word, but but speaking of leadership, and again, when I say not everyone who sees this may agree with it, but look, in the last couple of weeks, witnessing the Republican convention and President Trump's speech at outside the White House, where there was very little masking, almost no social distancing, and a lot of cheering. These are high risk factors for COVID-19 spread. And this is, look, what happens in the White House, whoever's in the White House, he or she is a role model, and people are going to imitate this, and people are going to think that it's not so serious and go and maybe repeat these behaviors which are high risk. And certainly if this happens in college, not good.
Gail, you want the final word.
I will say that leadership, right, are sort of the parents for all of us. We look to them that way. And as we're often telling parents who are saying, how do I help my child, whatever, one as a parent has to lead by example. So if you can't say, do this to your child, but behave differently and expect your child will do the behavior you've asked of them. So it is whether we're talking on the national level for all of us setting the example and how important that is. And how important, whether you're sending your child to school or you're sending your child to college, that how important it is as the parent to set the example for the kind of behavior you hope your child will do. If you're asking your child to go away and not socialize or not go to parties, then one would assume you're not doing that at home. If you're asking your child to wear a mask, if you're that it requires everybody to be giving up and setting a certain example on the national level, on the community level, and in the family, at the family level, as we ask them to how to manage anxiety by doing it for ourselves, and how we ask them to manage behaviors to mitigate risk by doing it ourselves.
Okay, well, thank you, everybody. This was very enlightening, and it's good to have you all here today, and I look forward to our next meeting.
Thank you.
And that's a wrap on episode 138 of the Psychcast. The Psychcast is produced by MDedge editors Gina Henderson and Jeff Bauer. The show is hosted by Dr. Lorenzo Norris. Our show notes are authored by Dr. Jacqueline Posada. I am your audio engineer, audio editor, and the voice of MDedge Podcasts, Nick Andrews. All MDedge podcasts are produced by MDedge executive editor Kathy Skarbeck and our senior vice president of editorial for Medscape, Dr. Ivan Aransky. This is the Psychcast.